Okay, everyone, let's start coming to order. We're going to start this on time because I want to make sure our guest speaker and you guys can get all the full benefits of education about jail services. Okay. Welcome, everyone. We're going to start and call this meeting to order. And Joe Waddell, you're not quite settled yet. You got your land acknowledgement in your pocket? Perfect, on time.
Good morning. Our land acknowledgement. We collectively acknowledge this gathering is being held on the stolen and unceded ancestral and contemporary lands of the Chinookan people and the Cowlitz Indian tribe. We pay our respect and gratitude to the indigenous peoples of this land, past, present, and future. With this acknowledgement, we commit ourselves to continued education, accountability, and social justice.
Thank you. So I'm very excited in our ongoing efforts to educate ourselves on. There was fire protection districts this month. Services. I have to admit, I selfishly asked Mr. Shook to give us Jail Services 101 because I frankly don't know much about it. So please, David, please introduce yourself and.
Well, thank you very much. So my name is David Shook. I am the director to a newly created department in Clark County called the Department of Jail Services. Did you have anything else, or am I ready to go? Good.
Can everybody hear?
Make sure I give the folks online there some facial opportunities as well, ask questions. And I'm sorry, sir, you said you were going to be the question person for chat over there?
I've got the,
Awesome.
I've got the chat. Good.
Okay, so I understand I have about an hour, which is awesome, somewhere around 30 or 35 minutes. If you have questions along the way, please raise your hand and ask specifically. Don't have to remember to the end. So I'll give you a little bit about my history and who I am. My name is David Shook. I ran for sheriff 2 years ago. Might have heard me in some of our conversations when we came and spoke to the League of Women Voters. So I appreciate those opportunities and I appreciate these. As we continue, as I started in law enforcement about 33 years ago, it was in the state of Oregon, in Washington County. I actually applied to work with Sheriff Gary Lucas up here in 1992, and for whatever reason, he chose to go a different direction, and I'm down there and did most of my career in law enforcement. So my last 10 years in law enforcement down there was involved with jail corrections work and having oversight and involvement in that kind of a realm and helping that team to be as good as they could be. I specifically worked at Washington County for most of those years. When I retired in 2018, I traveled the country selling body cameras for police agencies. So I had lots of knowledge, and I was kind of that geeky AV kid back in high school, you know, start the movies for the classes and things like that. And so along the way, I had lots of opportunities to learn most aspects of public safety. Correction. My sheriff down there was from the jail, and that's where I learned what a critical piece and component jails are for law and justice system, because it is a system. You could hire 1,000 police officers to go out there and protect us on the streets, but if there's not a place to take those incredibly dangerous people, or those that make a bad choice and break the law, then what are we doing, right? And so there's prisons and jails and local, and I'm gonna talk about the difference of what those are so that you can kind of understand that jail 101. And so, again, having been in that election, lots of folks got to know me, my background, where I came from, what I was thinking. And through that process, not making it through the election, the county management, county leaders, county council, they got to know me, and they're like, we've looked at about a half dozen or 10 people, and you're the person. You're our change agent. You're the one that's gonna come in and help us make our community better. Wasn't horrible, just better is what they were wanting. In this state, the law allows county sheriffs and county government to run local jails. There's about 7 counties around the state that run the local jail. And the sheriffs take care of the civil courts enforcement aspect of it. From many accounts, those communities are having a better effort at local corrections work. Not that the sheriffs aren't doing a great job, but they have a very broad requirement. And so this county leadership decided to go that direction. Most of the time most of the counties in the state who have taken on this behemoth lift of taking on the Department of Corrections, it's a 12 to 18-month process. Sheriff Atkins asked us to have it done in 3 months. There were some parts and pieces, and as he was coming out of office, which was fine, we still had to continue with Sheriff Porch. Sheriff Porch and we have an exceptional relationship. We work together very well. We support each other in the departments very well. He has a very specific mission. And so let's talk about what that is. The mission of a jail, local, is to hold inmates to get arrested by local police. It's a location to bring individuals. The current jail we have was built in 1984, 300 beds. At some point in 2017, 18, 19, there was up to 700 inmates in this facility. The structure hadn't changed. How they house them changed. There was a few extra beds added here, a few extra beds added here. And as I spoke about on the election trail, oftentimes the living spaces were doubled. So a space meant for 16 had sometimes 28 and 30 people, overcrowded. So when COVID happened, all the law and justice officials got together and they're like, who needs to stay and who can we send out to take care of later on, prioritize the most dangerous. And so they went down from it was a mid 600s number to a mid 200s number over several months. So that was what was released onto the streets. The prisons did the exact same thing. Is it Gary Ridgefield? Famous, infamous in this state, right? He was one of the final inmates that they were assessing. Are we letting that guy out? At the prison level, was my understanding. Those are the kinds of prisoners that were let out onto the streets because of the Department of Health and some of those rules, because of the pandemic. People often ask, why did the crime go? For many reasons, but a lot of criminals got let out on the street. And so when you look at the differences between local and state, the state has right now about 12,000 inmates population. They have almost 20,000 beds. I think in the news you saw last summer, Large got closed down, many other programs got closed down. During COVID, they lost over 300 officers. It takes staff to manage those locations. So local here, staffing is also an issue. I'll talk about that when I get a little further on. So local jails hold people who get arrested and convicted of crimes, and they're held up to 364 days, up to that year. Anything beyond a year, they're supposed to go to prison. And so that's really the barrier. The difference between a state prison and a local jail is in a state prison, if you have 600 beds, you have 600 inmates. So when one leaves, one comes back. In all local jails, you have this turnaround because inmates come and go. They process out, they bail out, the processes work, their courts are done. And so today we had 434 inmates. But yesterday was 436. Tomorrow it could be 440 because the weekends get really busy for us around here. And so as we continue in that management, last year we had 6,000, I think it was a 200 number. They're just finishing some of the stats for me so I can put that out. But a 6,000 number, last year it was 5,200. So it was about 1,000 extra inmates that had gotten processed through the year, and I'll share why that happened. So when the county manager and the county council came to me and they're like, we'd like you to run this jail. You have a blank slate. Make it the best, make it better than what we have. Figure out what we don't have and what we should have. Reach out to all the experts that you need. We need to make this a better system, law and justice system for our community. During those times, you were having a lot of livability crime issues and things like that. For about 6 or 7 years, misdemeanor criminals that were brought to the jail were instantly brought in, fingerprinted, information taken, and sent out the other door, oftentimes before the police officers got back to their workstation. We've changed that. And so Jail 101, taking care of it. So right now, that 434 number I told you, 90% of those individuals are pretrial. So the police have arrested them. Prosecutors and defense attorneys are looking at how to process them, finish their cases, and figure out whether, what happens to them. 90%. 70% of our jail is the city of Vancouver, and rightly so, right? The largest city in our community here. And so as you look at the smaller communities, those communities are all trying to hire police officers. I heard the sheriff say the other day, they're about 21 bodies down. City of Vancouver, somewhere in that 14 to 20 range as well. When we started managing the jail in January 1st of 2023, I was 32 bodies with vacancies and another 12 bodies that weren't available for myriad of reasons, leaves, injuries, things like that. I had 147 total employees managing 480 or so inmates that first day we started in January. And a third of that staff were gone on a vacancy. So what was happening is most of the staff were working 16-hour shifts, 4 days a week. So just think in your lives, working 8s, 10s, and 12s, and then being told by your boss, by the way, you can't quite go home yet because I can't find somebody to fill that post where you're managing 20 to 50 inmates. That happens daily. And it still happens today sometimes, not as much as it was last year. So our first focus was, first of all, getting all of our staff the right equipment because they didn't have it. And the second one was actually hiring those people. So we hired 28 people last year out of the 32. The last 4 we had offered jobs to, and 3 of them, their backgrounds came back not the right kind of person, and the 4th one, they had failed their psychology or psych test. So we were real close to making that goal. Now, that's amazing on that 32 number, but at the same time, I had 4 employees that retired because they'd been there 30 plus years. And I'll tell you a little bit about that in a minute. I had another 5 employees that didn't make it through training, right? So we didn't quite have that. But we had about a net of 20, which was more numbers than they'd had in almost 20 years. They've always been right around that 30 number. And again, for whatever reason, and I told everybody in my staff, January 1st, I don't care what happened beyond. We're doing about 100 miles an hour this way to make things better for us, our communities, and to make it safe for inmates and you when you're in here working. Every time you see on the news one of those stories where somebody is killed or significantly injured, think about 18 months. That's how long it takes for somebody to get processed. So through COVID, when I first started looking at our inmate population, I was able to get in there and look at some of the individuals that we had been holding. We had some inmates that had been there for 4 years. So just think, up to 365 days, right? But because the courts were slower, the prosecutors and defense attorneys weren't working as much because it was all distant work. And they were trying to fit the system, fix it, right, to figure out how can we actually do Zoom courts and how can we do these processes? Because some of the laws require in-person events. And so once they got some of those things worked out, they continue to work on it. So one of the very first things I started doing was kind of beating the drum on, I need this system to flush a little bit and get these people that have been here for 3 and 4 years out of here. Because you keep arresting people that need to start their processes too. Now, in this state, Oregon, and many other states around the country, there is a deficit in attorneys, defense attorneys, as well as prosecuting attorneys. In this state alone, and you might have seen something in the paper recently about a indigent defense department being developed by the county. For the largest county in the state without a department does that work. We spend money on all the attorneys with contracts. It's just the process that they use, and many counties use that still. And just because they developed this department and they're identifying a director for that position, they're still going to have to contract with some attorneys. There's just not enough attorneys to do that part of the work, but you have to have the police that arrests, you have to have the jail that holds, you have to have the prosecutors that prosecute, but you also have to have the judges and the defense attorneys and the system around all those humans, because that's what they are, to get them in and out. If they're supposed to stay, they stay. If they're supposed to go and handle it through some other process, they should go do that too. One of the things that Clark County for many years was really a leader in was the reentry programs. One of the gals out there checking me in, she asked if, hey, can outside programs come in and provide services? I have currently about 100 programs of services of folks that want to come in and provide services to the inmates. And we'd allow them to do it if we had the space. We don't have the space. So that whiteboard that the county managers have talked about, that the county council had talked about, that's what we're building back. Because they used to do pretty good. 2016, they were going pretty well before COVID hit. And then COVID closed it all down. We didn't let people from the outside in. We were having enough issues with COVID issues on the inside of this jail. Our employees, inmates, everybody that was inside. And so we had to restrict a lot of that. But again, a lot of the inmates were released except the most dangerous. And so in that triage and closing everything down, when I took over in January, we started looking at how do we open that back up? Because the inmate numbers started to rise quite a bit. And if they're in there, we got to figure out how to do something to help them. Now, the ones we focused on most were the most likely to release back into our community. Right. And so as I was driving down Andreessen today, of course, I think this is Burnt Creek Park, you know, there's all the tents and stuff. We have a big group of homeless. We have a big group that are experiencing sort of mental illness. We have some that are just sociopathic and they can't be with other people and they hurt others. And so they have to be in individual spaces as well. And when you have today, and I'm sorry, let me add this one piece to you. During COVID, we went in, we measured every square feet of the jail. Every inmate is required to have 36 square feet of space. Constitutional care is the level of care that we require in our jail today. So every one of you, it's a 6x6, right, general length. Now the cells were built before ADA. They were built before these rules. And so the jail cells are about 70 square feet. So again, we've had conversations with the Department of Justice and those that look at ADA and some of these rules and said, hey, we're in the process of remodeling, we're in the process of all these things. This is on our list to hopefully fix. Can we have a moment? And they're like, yes, we'll come back. But again, it's in that care. We manage inmates through what's called a classification system. So this table over here were theft people, and this people over here was a murderer. Sorry, ma'am, I don't think you are. We wouldn't put them necessarily together. Their behavior, their previous and current behavior dictates where they're at. And so anytime we look at somebody's history, we have to evaluate it and then put like people with like people. Because otherwise we get sued. And so that liability and being sued is not what I want us and the county to have to go through. So again, constitutional care. But just think of everything today that you did. Showering, laundry, food you probably ate, safety and security. Everything about your human life, we have to provide these inmates who are temporarily inside of our facility. And so that's what my officers focus on. The housing, security, the physical safety. And if we don't, they let us know. And if we don't, lawsuits let us know as well. And this state is very easy to accomplish those things. So it's easier to make sure we're taking care of it on the beginning versus the end. It's just the right thing to do anyway. Cells are 7 by 9. That's not a lot of space to have 2 bunks and a toilet and a sink. That's what they get. Inmates get out multiple times of the day. If it's an area where the inmates, their behaviors are okay, they get out many hours of the day. If they're in a space where their behavior is causing issues for everybody else, they don't get out except for an hour a day, right? So there's some behavioral things they can do to get more time out. Now, we use electronics and kiosks and tablets for our inmates to communicate to the outside world, to get email, to get mail, things like that. So some of those things are a lot technologically advanced, right? When we first started in January, we had 2023, we had 20 overdoses in fentanyl. You all have heard about the fentanyl issues that are going on, and oftentimes those make it to the jail. So inmates are sneaky, and mail is a way, secreting things is a way, sneaking things into a facility is a way to bring in drugs and other things that they can use to trade with other people. We started scanning mail, I think it was October of last year, and our overdoses on fentanyl went down significantly. And I'll just tell you what they do. They'd melt the fentanyl and they'd put it into their letters, right? And so if you were to look up into the sky, you could see that there were some dark spaces in the letter or the envelope, and they'd usually put it in the glue spaces, and they were very smart about it, but we just got smarter. And so now we don't send those to them. They get their letter, they get the envelope, everything's digitized, and we've lessened our overdoses, not 100%. In that same 20 overdoses, 5 of my officers were exposed by fentanyl. And the same Narcan that inmates had to receive, my officers had to receive as well. That's a scary proposition when you're just there trying to do your work, and by touching something, because that's how that drug is exposed to you, you're off to the hospital as well. So again, everybody in my staff, we carry those kinds of preventative drugs, Narcan and other things to help. And we've lessened that opportunity. Fentanyl is a much harder drug than heroin or meth to come down and knock up. They estimate about 2/3 to 3/4 of our inmate population have some sort of an opioid disorder, use disorder, where that's their drug of choice. It's not the meth anymore. It's not the cocaine. It's not other drugs. It's that, because it's so cheap. And so as you see in the community, our jail is the very first jail to have a Narcan dispensing machine. And we've sent out 260 samples in the last 3 or 4 weeks that it's been open. Because of the types of folks that come into our facility, they see this resource. Now, you can go anywhere in the state because that is free, right? Rest stops and hospitals and all sorts of places, and find Narcan for you. And I would suggest if you don't have that, just as a precaution for somebody, might be a good example to go get. And so jail 101, right? prison, jail, temporary versus long-term are the most of the things that go on there. Once you're in a prison, other than going to other local jails to have maybe another crime evaluated or another state because they caught you for something else, you're pretty much just there. And they have a lot of those programs that prisoners at that point can go into and say. Any questions about jails and prisons, differences there? Just answer those real quick. Okay. So we talked a little bit about the transition from the sheriff to the county department. Those discussions have been happening for long before anybody knew my name. It just happened to be where the stars lined up and they're like, today's the day. It's actually worked out pretty well, and every time the sheriff and I go and speak in places, he's very supportive of it. Our county is the second oldest county in the country, right behind Washington County. So 1845, this county's been around. But this state has provided those opportunities for counties to make that change. And I think it's been pretty good. So when we hired all those folks, the extra 20 net, we've been able to do more things. So those programs, I'll talk about some of those, are reentry programs. So first thing is always security. Do you have enough staff? Do you have enough things? Can you do the things that you need to do? We're often fighting folks. And so let me describe our jail just a little bit more so you can understand the complexity of how we manage those inmates. So we have 4 maximum security places to hold people. So we have a male section. We have a section for those experiencing mental health issues. And then we have 2 general population max spaces. In those 2 spaces, we have to separate gangs. Right, so you have a Norteño gang group and you have a Sereno gang group, and then we manage those general population spaces. Again, they oftentimes, if they see a competing gang, they fight on site. That's their rule. So oftentimes my staff are having to make sure when we're moving inmates from one living space to the next, that they're not moving them at the same time, because they only have certain opportunities. And so it gets very dangerous. The other thing about my staff, because in Washington State, the retirement system is nice, but for corrections, they require them to work until they're 60 and 65. Law enforcement is 53. And so I have about 6 or 8 staff members who are over 60, and they're managing 18-year-old and above people that have been accused of committing crime. Some of them very dangerous. So some of you in the room think of that. What would that feel like, be like? And there is no extra places for me to send somebody who's maybe senior, has been in the job a long time. And in fact, if you retire before you hit those marks, even if you've been in the job for 32 or 35 years, your pay, your retirement. So anyways, there's some changes coming around in the discussion about corrections in the state. They're including them in a lot of support and other things, because historically it's just been law enforcement, those that drive around in the police department. They're changing that finally because they're showing my staff have more, sometimes PTSD and other issues, dealing with inmates on a day-to-day basis. Instead of that one emergent event. Every day I'm dealing with this very dangerous population. So finally, some folks are thinking about, wow, we should probably support them a little bit differently, thankfully. And so with my staff, as we've created these new programs in these new spaces, I'm going to talk about 3 jail spaces for us. We have the main jail. It's down there at 707 West 13th, where the sheriff has been for most of his years here. The red building across from the courthouse, 1980s. They've remodeled it along the way, added a few spaces. There's a space called H-Pod that they added outside, but inside of the facility. It's a minimum security. So there's 3 levels of security. One is minimum, medium, maximum. Talked about those 4 maximum spaces. So when you think of minimum, that's the least. It's not the mental health having the least level of crimes, it's a minor theft, it's a minor damaging of something, it's a minor something. The ones you don't have to, if they walked away, you're like, I know who they are, we'll pick them up later kind of an event, right? We have a space with 56 beds in it. So for the last, I think it's 6 years now, that's been mothballed because we didn't have staff. And again, in COVID, we let out all of those minimum security and many of the mediums. As we continue though, as we continue to change our population, we still can't use that, but we filled it up with all those reentry programs like you were talking about, ma'am. Those folks that can come in the jail and go upstairs directly and deal with inmates. Right, and so is the other place that we have is what's called the Jail Work Center. It's down on Lower River Road. It's been there since I think 2000. And they've had historically inmate workers down there, the low minimum, some medium, but mostly minimum inmates that were cooking and doing laundry and yard work and all those kinds of tasks. Again, we don't have those folks anymore. So prior to COVID, and I think it was 2018, less and less people down there able to do that. We had to hire temporary staff. I spend about $400,000 a year on temporary staff that are cooking up to 1 million meals a year. So 3 meals a day, and we also do juvenile. We also do Lifeline, the ITA clinic down there. And we do meals and laundry for all those individuals that are in the county system. But again, one of those requirements, right? We've got to be able to feed and house inmates and provide them those, not comfort, but those required events. And so as we look at that site, one of the things that's happened when we first got here was, hey, we have been on this restricted booking status for 6 years. How do we change that? And so we created a red, yellow, green system like you would see on a light stand out here for the police to look at. When I worked at the Clark County Sheriff's Office from 2020 to 2022, I wouldn't know when I could take an inmate or an arrestee down to the jail. I'd have to call almost every time because you just didn't know. But we made it, we simplified it so that you literally every morning they get an email from us. It's green today. Today was green. Bring everybody and anybody. Yellow means, hey, we're a little fuller. You can bring everybody local, but don't bring people from out of the state, kind of warrants and stuff, unless it's a required. There's certain warrants that are required. And then the other part is, how do we get them in and out, right? And so that's where we focus, a lot of that. And so as we continue to manage those inmates, is how do we do it better? We have some inmates over in Sabine County. It's so that they can be bringing people local here, because otherwise we would be back at the same restricted level. And so that's helping us out right now. And so you may have seen in the paper maybe 2 weeks ago now, a discussion about a jail space down at the work center. That is going to be a living pod. It's not going to be another jail per se. It's just going to be a secured location. We have about 11 acres down there. And we have the industries and we have the inmate worker areas that used to be there. And we're going to add a standalone living space. Not going to be a full space. And so anyways, what that does is a couple of things, is we are talking about remodeling the current facility. CFAC in 2018-19, when they finished that, it was an 18-month project. They talked about multiple things, taking over the juvenile department, remodeling the current or blowing down the current jail and building a new one, doing something down at the jail work center. Well, we combed through those plans and ideas. And instead of blowing it down there on the main jail, we thought about remodeling. 1980s, old technology, all the conduits are full of wiring and everything else. We can't change anything. When I first got there in 2020, there was plastic viscine all over the ceilings. And I'm like, oh, remodeling. They're like, no, it's to keep the PCs and stuff from coming down from the inmates, because all the inmates are above. I'm like, oh, that's a different place to work and really live, because you're there so many years or hours. And so as we have started this new project, we've moved it along. And so we just finished here a month ago, the programming, which is bringing in all the experts in correction. What do you need for a modern facility? What does it need to look like? What does it need to be? It's so dark, dank, and really not a great place to be. We do give tours here and there. I gave a tour to the Law and Justice Committee, and I did in Clark County yesterday and the day before. We did the leadership team yesterday. And it's really just that opportunity to see why we need to have something different. So let me talk about where we're going. I've talked about where we're at a little bit. I've talked about where we're at today, some of the issues with inmates and employees and the programs and things going on. And let me talk about a little bit where we're going. So inmates from the 80s and earlier were more simple. Today, they have many of these issues that we spoke about, whether it's mental health or violence, or they just need to be by themselves. In the current jail, we don't have the flexibility to house people where they need to be. And so as we continue to look about other facilities around the country, we found some ways to be able to create efficiencies in space, to continue having a general population, but also having a transient population inside the jail, because most inmates are there for 1 to 3 days and then they leave. But we also don't want inmates to be able to bring drugs and other things into the facility, right? And so being able to sequester that off. The other part that we're looking at is adding more space for many of the community providers that need to come in and do work with their inmates. Because again, we can't be the only program. We have so many other programs that come in and help those humans that are inside of the jail. Made bad mistakes, they're bad people or whatever, they're still humans, and we have to provide opportunities for them to be moved along, whatever direction. If it's up to prison, then that's where they go. But if they're gonna come back out into the community, that's where we focus most of our efforts. How do we keep them from recidivism? How can we lower that recidivism rate and so forth? Doesn't always work. Might not be the first time, might be the 4th time that somebody comes back and these programs are voluntary. They're not they're not forced on individuals, because if you're not ready, guess what? It's not happening. And so we've had courts are like, this person, and we're like, listen, Your Honor, there's too many people that want to be there versus this person that's not ready. And so again, we have conversations with those other partners to say this has to be voluntary. But we're setting up those programs now. In fact, there's an opioid abatement settlement. And I think this first year was $500,000. We just learned yesterday that we're getting about $264,000 of that to deal with the inmates inside of our facility. Again, if there's about 2/3 of the population, that's about 3,800 from last year's numbers. And we only hit about 1,000 of them. We're missing some folks. And so again, as we continue to add to this facility, I would love to come back and in different phases of discussions and what does the remodel look like? What do we need? What's the support? How can you all help us? I'd love to come back and share some more of that information. It's a much longer conversation. That would be another hour. I don't want to bore you at this moment because we have some really strategic things coming up in maybe the next 3 to 5 weeks. And so as we continue to develop that, we continue to look at the future, because again, if we don't have a kind of location that is focused on recidivism and helping folks that way, but also safety and security so that the police officers on the street have somewhere to bring somebody when it's necessary. That 2 years I was on the road, oftentimes we were shooing people around that were causing issues, maybe in your yard or your business or somewhere else. And maybe you've experienced that because the hospitals are busy. Who's been to the ER recently, but the last time I was there was 8 hours. Right? And so there's no place for individuals that are in crisis to go. And so as we as a community come up with some possible solutions to solving that, many of the systems are overwhelmed. The state system of funding things is old and antiquated. I was just talking to Torres, right? Sharon, about the old system, 1990s. The county's currently working on 1990 policies, trying to update them. When we transitioned, I'm working on 1990 policies, trying to make them 2023 and beyond policies. And the state's the same way. And you probably experienced that in many of your businesses or opportunities when you're dealing with government. Is it's slow, antiquated efforts. And so we locally are trying to improve that. At least my department and my jail, we're gonna be trying to modernize what we're doing here, making things more efficient, getting people to the state. And so anyways, I hope that that provides some context to where we're at, where we're headed. I want to give you some time to ask some questions. If I miss a hole or something.
Raise your
please
hand or
ask
you
that
can put it in
question. I'll
chat if
come
you have
back
a
another
question.
day if I need to, but this, I hope, is just the first start. I can't remember the gals I was on the radio with, several months ago. I got on the radio and spoke with one of your teams of folks, and we had a really great conversation, so.
That's September, Tracy and Teresa.
There you go. Go ahead, Joe, and I'll repeat it so everybody can hear it if you want.
You have folks that come into the jail with medical issues like diabetes, mental health issues where medication is critical. Would you talk a bit about how you deal with that?
Yeah, so Joe's question was, we have folks that come into the jail that have medical issues, and we have a really sick community. Those folks especially that come in, and how do they get diabetes and other medications? And so anyways, we pay about $6.2 million a year to have a medical provider on site. We're our own little hospital. We have enough people that come and go, and they've got all the normal urgent care events, but then we also have the ongoing emergency care events and sometimes trauma type events, right? And so we have a pharmacist and we have a doctor on site and nursing staff and other LPNs and other levels of medical professionals that provide that. We have a nurse that doesn't let inmates or arrestees come in the front door until she asks them, hey, were you in a crash? Were you using drugs? Were you doing triage, right? And if they were doing any of those things, the law officers have to take them and get cleared. Right, so we have the professionals in-house now, and again, it's a type of how we provide that care that is different from jail to jail. Some jails don't have any medical care because they're small. Maybe they only have a dozen or more inmates. Some provide their own, so they have their own doctors and nurses that are their employees for the county. And then others do the method that we have, which is contracting out. And so we're, as we, again, kind of like, how do you eat an elephant, right? One bite at a time, is we're taking each of these large programs like you just asked about and evaluating them to see, first of all, is it still the right way of doing business? Costs. Is it the best care possible? I would say that there are some gaps in that we want to improve and add, like the mental health providers, for example. We should have more. But again, it's that cost value, right? And where that's coming from. So we're looking for alternatives on how do we actually have that. But the basics of medication, especially if you come in, you're like, I have 3 medications, it's A, B, and C, your loved one brings it down. Our medical team will take those and go, okay, compare medical doctor notes from your provider and then provide those exact same medicines for you. Twice a day, we have nursing staff to go through all the living spaces and give medications to the inmates. Anybody else? Yes, sir.
That's a good thing about the cost. I look at it, it seems that Washington has no private prison. That's where we down.
That is correct. It's against the law for private prisons here in the state.
Okay, so somehow Washington has figured out how to fund prisons, maybe not as adequately as we'd like, without having to go that route, while some states have decided to use private prisons, and I wonder how come they can't do it?
Sure. So, great question, by the way. So his question was why doesn't Washington state use privatized prisons, right?
Yeah.
I think if you were to go to Oklahoma and many of those states that have privatized prisons, you'll see that the care and comfort being provided is less than, right? And so that is a part of the reason why the state has decided many years ago that county, sheriff, you bet, state, you bet, but privatizing jails and prisons is not the way that this state wants to go about it. The taxing and how they provide criminal justice funds back to each of the counties is a method of discussion. I think it's called Washington Counties, WASIC, I think is what it's called. But in the 80s, they went around and they paid for all these jails. And again, they haven't done it since. And Skagit County is the most recent jail that's updated, remodeled themselves. And hopefully, they talked about it this legislative session about what are we going to do? But I think next legislative session, there's gonna be more traction on jails needing help, because that's how they do it in the state, is to pay it through their tax, the way they do funding. So anyways, great question. I think there was, come back out there. Definitely.
Another comparison question. You mentioned that we find better. And I'm wondering why we don't pay attention to what we do. A recent documentary for Scandinavia and they do not allow death penalty. They do not allow life imprisonment for any crimes whatsoever. And for many of the inmates, including murderers, instead of putting them in prison, they put them in permits. They treat them as members of the community. How figure out how to be productive members.
So this was a comparison question, and I'm sorry, what's your name? Linda. Linda says in Europe, they have programs where various individuals who are accused of crimes, whether it's up to murder, they're treated differently. They're not put in prisons, they're put in apartments and provided resources and other things to make them better at what they're doing. I don't know about Europe. What I would tell you is that I've had to fight, and sometimes those individuals have been mortally injured, trying to hurt me and kill me, right? And so I don't know what happens to those individuals who are hurting and killing those around us, and how you make it safe, right? Excuse me. How do you make it safe for those communities around? So that's a very interesting comment, but in my experience, I don't know how that would work, but I think you're right. I think everybody should be, those that are in charge of that. And again, I'm in a local correctional facility, right? I've never read anything in all the literature in all my years of how in the United States they would do that. And again, I think it may be much different, but it is a differently and interesting question. I don't believe people should be locked up forever. I think that people should be provided resources and individualized. It's kind of like going to school, right? Not every student learns the same way. Not every person who has committed a crime is doing it because of the same reason. So there's not a magic pill to give out there, but there is opportunity to say, hey, you individually, how can we provide you the resources you need to then maybe help you? But it's all independent too. If I'm like, I don't care what you said, Linda, I'm gonna go out and hurt somebody else again. Not me, David, but me, the criminal, right? I'm gonna go out and hurt somebody else again. At some point, how do you keep the community safe? I don't have that answer. Yes, ma'am, you had raised your hand. Sure. Yeah, okay. So the question was, could you please clarify a little bit, the jail work center and down on the 11 acres? And so that was built in, I think, the early 2000s, if not 2000. And there was 200 inmate bed spaces down there, identified for work release. And the other one was for industry workers, so the kitchen and laundry. We're building a standalone 64 cell living space so that make down there, and especially during the remodeling process. Every living space, we have a G pod, an A pod, a C pod, is about 100 inmates. And none of the jails around us could house 100 inmates, right? And so right now, in that 15 a day that we're renting, and right now, I think today was 13, annually, that would be about $300,000, right? And so there's not going to be any space to move a bunch of inmates to be able to handle that. And so that's our first step in releasing some of the pressure valves with the law enforcement so that they don't get to the red. They don't get to that red state where, sorry, you can't bring in individuals. Currently, we're not allowing the Department of Corrections to bring in any of their folks that they manage that are for minor events. So, hey, you didn't call me today, and they put a warrant out for them. Those folks aren't coming. It's the ones who committed more crimes, and there's a warrant attached to them, and then they're staying, and then DOC will take them up to Shameless and other places where they can house them and do some of the business they need to do with them, but it's just that way of localizing our crime system or our arrestees all around us regionally. Washington County is my example, because that's my former home agency. They've closed 3 of their living pods. So about 200 inmates are no longer at that jail because they don't have staff. We've not done that. That was one of our very first business discussions in January of this 2023 was, do we have to close some living spaces because we don't have staff? And the answer was, it's critical to keep those open for the law enforcement around it. And so that stays down at the jail work center, which used to house 200 minimum, right, the lowest. They're now gonna have 64 beds that are gonna be that medium level, but it won't be, oh, it's okay, you can run away. No, it's gonna be a full jail housing where security would be provided and everything. So I think there was.
And I have a question, how you keep up to date or will keep up to date with other folks like you within state and also outside of state. What have been their successes in life? And what are the ones where they have found that they have issues, but this is the way they do it.
So Edry, right, is that your name? Edry had a question about how do we keep up and keep communicating with other organizations around the state and who do different things and different efforts and different processes. And so twice a month, I meet with all the leaders of jails around the state. And there is a more concerted effort to communicate programs and issues and things and work on it. Not, again, that's a very great question, because what I first learned here when I first got here is many of the programs are very silent. Kind of like, I'm gonna take care of this. I'm sorry, Joe, I can't tell you. Nope, I'm sorry, I can't tell you. But in the jail, and it started with COVID, because people wanted to know what everybody else was doing about the Department of Health and how are you managing COVID and everything else. And it's turned into, hey, by the way, we're gonna have a medical conversation here. So that's the first thing, is more communication. Each of these 7 counties that are like us, we have follow-up other conversations. And that allows us to speak more directly about the differences of not being a sheriff's component of an organization that way. And so that's how we do that way. We send folks out to regional trainings in this state and also nationally to make sure that we're getting best practices. And I've hired some exceptional leaders in reentry, transition, training, who she's one of our regional experts, right? So people call her to ask for expert opinions about reentry efforts. And so we're layering it that way first. And again, staffing is our first priority, making sure that our facility, and now making sure that our programs that we're putting into place are the best and up-to-date efforts for our inmate population and our community there. So, and like I said, that 100 group that's around the jail wanting to come in, they're also experts in all those realms, whether it's homelessness or mental health or drug issues or many of the other, and there's many of them. If you could think of a person who doesn't have the most basic thing that you have, which is an ID. Most of the folks we have, they don't have ID. They don't have a way of proving who they are. Many of the systems that are out there federally, state, and locally require you to be able to identify yourself. So we work on those things. Some of the criminal history affect individuals. If you're in the jail for more than 90 days, your status as a homeless person with all the other programs gets restarted. So just think if you've been houseless for years and you're finally getting into the system where you can now start doing things, and now you come to jail for 92 days, you have to start over in the federal programs and some of the state ones. So again, it's trying to find where some of those restrictions cause further hurts and process issues, and making sure those methods are fairly smoothed out, right? Flushing those systems. There's so many people trying to create issues. One of the issues about houselessness or homelessness is that many counties don't communicate with the state, or they don't communicate county to county. And so an individual is transient they'll move from county to county to get all the resources they can and then start back over. And so if you're going around and you're getting all the resources, but they all have the same homeless doing the same thing, why don't you stay in your county and I'll stay in my county and this person will be over here and let's communicate. What have we provided this individual? Right, so there is some communication and some red tape, I think that's keeping our communities from being able to put all their resources together and come up with some solutions. So I hope I answered your question.
Yeah, and I also, what is going on in other parts of our country that also bring lessons to learn. And as you have been saying, things are evolving. So what might be successful this decade or this part of the decade may not be in the later part of the decade, as you talked about change. So that's really where a lot of the learning is and being open to, and you say that you are, but I wonder what is set up for people like you in your position that you can then communicate with people in other parts of the state that are also part of that. So,
Yeah, so just to answer a couple of their, I actually get a lot of calls like, hey, how are you hiring all these people? We have 100 vacancies. I can't figure out how to get somebody in my door, right? So we're having some of those conversations. Programs for inmates and how that goes is a constant conversation, relationship building, and it's not just locally state, it's regionally through the Pacific Northwest and then through like portions of the country, right? And then there's some national things. In fact, next month, I'll be going off to a class down in Texas that provides a layering of future correctional processes, practices, and things like that. And again, culturally, this has been the same way for 30 plus years. And so they've been really kind of isolated in what has been told to me because they didn't really reach out to other organizations. They just did their own thing. But I think as we continue and some of the things that we've heard from some of our partners, like the courts and the prosecutors and other externals, is we've never been asked questions like you're asking us before. How does this work? How do we together, there's a gap here. How do we get, so here's a quick example is oftentimes courts happen and because they're so busy, we don't get paperwork until 5 p.m. Right, but if we're letting out somebody with a mental health or a medical issue at 11 o'clock at night, where's the partners in the community going to be available to come to the jail at 11 or midnight? And so we're working with the courts, and I saw your hand, sir. We're working with the courts and others to say, I need those earlier in the day so that I can make those arrangements to get those people to the right spaces. So we're working really hard to create those relationships where, as I've heard, have never been the way it's been done before. So, and again, that's just not my experience. That's what people have told me. So, yes, ma'am, you raised your hand. Yes, Mary. Absolutely. So Mary asked a question about staffing and 16-hour shifts and then inmates. Do they get out during the day and can they like go places? And it's not outside the facility, but we have some outdoor rec places. We have outside of their 7x9 space that they can make phone calls, take showers and do other things. So that's that part. Our employees work 412s and so they work, yeah, I know your face back there. I did. Yeah, yes. And so they work 412s now, and oftentimes because we're missing staff on either shift on other sides of them, they work another 4 hours. And sometimes it's spread it out, they'll do 2.5 this side and 1.5 the next day when they come in, and so our sergeants are managing that all the time, and so 16 hours is a safety issue beyond that. It's probably a safety issue after 12 hours, right? But they also really like that because for the 4 days they're off, we don't call them. So they literally get 4 days of respite to get relaxed. And again, I came from an organization that for 10, right? So you're not so exhausted every day. So that, yeah, I don't need the 4 days to really go. So we're working on that a little bit. It's been around for such a long time. It's really a fight. So we'll see where that goes. Yes, sir, you had a question.
Yes, it was a question on chat from Jessica. I got it up there on the screen. Asked about Clark College and WSUV programs associated with the jails.
Okay, I'll read it. For you.
Okay.
can you ask him about College, and I should get my reading license out. Clark College and Washington State University programs associated with the jails and prisons. Also, I just read that Clickitat Jail is closing. Can you ask him if there's an update? If the jail is closing, where the inmates are going? Do you know why it is closing? Yes. So a couple of things is that in colleges, most of them, law enforcement, corrections work, programs like that, they do offer those kinds of extra programs, right? As a police officer, I could go there to study. We don't have any inmate college kinds of programs currently. That's not our thing. And again, our inmates, we have an average daily or average stay rate of 27 days. So in 27 days, what could we do with an inmate, right? And that's an average, right? If I took out all the less than 72-hour people and all those, the average would probably be up to 4 to 6 months, sometimes a little longer, sometimes a little shorter. But those are some of those different things. So Skamania County, for example, that's who we contract with for our 15 beds. They're in the process of probably closing down their jail as well. Because they don't have a lot of inmates, they don't have a lot of people, they don't have a lot of staff. But it was an opportunity for us to use them as as a place to put more inmates. Clickitat, I'm sorry, that's the right county, right?
Clickitat,
Yes,
yeah.
Clickitat County, they have the same issue. And so my jail budget's about $36 million. Skamania County is about $2 million. And I would assume Clickitat is somewhere less than that, smaller agencies, right? And so Clickitat is actually going to be busing or taking their folks down into Oregon. I don't know if it's Norcor is a jail down there, or if it's like Hood River in that county, but they're going to be contracting south into the state of Oregon. I think you can go right across the big jail from Clickitat, something in that state, one of those bridges, but they're gonna be going down into Oregon. 11 o'clock. I apologize, I rambled on here a little bit. I hope it was informational. I know you're all here on your day, so I want to say how much I appreciate you asking me to come here. This is the start. I hope I get to come back and share updates and details as we continue to move on, because we really need everybody in our community's support to determine how do we go? How do we go, right, Linda? Which direction are we going with our community? Because it's very different. Community to community, state to state. And as we get more information and we find opportunities to share what's out there and what's available to us, I want to be able to share that back to those that are interested. So thank you very much.
You're welcome to stay, or you can.
Well, my wife's at home sick, so I'm gonna go home and finish taking care of her. So I appreciate the phone call. We've had me do all these sightings, and I'm like, I gotta go, honey, I'm sorry.
Thank you so much. I learned a lot, I had no idea what I was asking for when I got on the phone. All right, so we are ready for committee reports and announcements. Nancy, would you start us off? This one's gonna be the membership orientation in 2 weeks.
All right, then you won't be at, we're just gonna have to pick up your slack, which, oh my God.
Good morning, everyone. We have sent out in the voter a couple times, and many of you have gotten an email from myself in regards to April 27th. Here at 10 a.m. will be a very special member orientation, League 101, to re-engage with each other and to welcome new members. We've had quite a few new members in the last 12 months, and we want to make sure that we are identifying their interests and allowing them to participate where their passions are, and re-energize all of us and spotlight our committees, talk about nonpartisanship. We are going to have a luncheon. I have a couple sign-up sheets for, we need a bit more food and some beverages and a little help in the kitchen. People have been so wonderful to step up and help. We have a short slideshow, and Tracy Riley Kelly is going to talk a little bit about our history, spotlight one event. And then we're going to break into small group discussions. So each table
We could use a few more moderators for that. It's basically to get the conversation started with a question, and it pretty much takes care of itself because we all want to talk. So that's not a huge thing. I unfortunately have to miss it because of the family event, and I hope to be on Zoom for part of it. So anyhow, John's going to lead the group discussion on Zoom. So hopefully we'll have everything all covered. If you have any questions, concerns, suggestions, contact Ellie. She's our point person. She and Sharon are going to be moderating. So it'll be great. Absolutely great. I just want to say a couple words about nonpartisanship. This is the statewide survey that they did a couple years ago. It was external, internal. Interesting discovery. Members don't understand nonpartisanship. The public doesn't understand nonpartisanship. And people don't think that we are nonpartisan. So we need a little bit of self-education in that area. And this is a very critical election year, and people will be looking at the league. So we want to make sure that our nonpartisan hats are on securely. The state, let's see, on this upcoming ballot in November, there will be 3 initiatives, and you probably followed that in the news. There were 6 initiatives, 3 were passed by the legislature, 3 are going in front of the voters. The state league has come out and they are publicly opposing all 3 initiatives. Okay, that is state league, all right? When we are involved with voter services, when we are registering voters, when we are talking to people about their ballots, we're talking to people about this is on your ballot. If you vote yes, this is what happens. If you vote no, this is what happens. We do not talk about our position. We do not talk about the state league's position. That's advocacy. And that's a really critical thing to keep in mind for all the future discussions this year. And if you have any questions about it or any concerns, Mary Schick is the co-chair of the State Voter Services Committee, and she will be happy to give you guidance on that. Yeah, this is something we really need to be aware of. Real quickly, the Reform Clark County group here in the state of, in Clark County submitted an initiative in December. It was rejected. They resubmitted it in January, and in it, they state that the League of Women Voters have questioned the security of the Clark County elections. National League gave us some wording. We had a 1-sentence wording that we put into the Columbian in January through all sorts of national not doing something. Anyhow, bottom line is the wording is still in the initiative. It's going forward. There are all sorts of signs up. They're doing a big public push. Signatures are being gathered. Our name is still on it. And so Sharon has been working with a few other league members. The board is also on this to prepare a letter to Reform Clark County. They are supposed to put a disclaimer on their website, you'll see, and a press release about our actions. So I just want to let you know that that's in the works. Go ahead, Deanne.
Wondering if it would be appropriate if you wanted to encourage individual members to write letters to the editor in any way. Is that appropriate or not?
If you don't use the league's name, I mean, because you're not as a private citizen, but you know, she speaks for the league or in an op-ed that has a league signature. Edwin.
Just wanted to add on, it took us quite a while to get the Columbian to go and state in the article. It took quite a while, but it did state that we were not advocates for it and that it was put in without our okay. So I just wanted to let you know, we have done some things already, but the Columbian only goes to so many people, and any of you know, when you read an article, you only read part of it. So that was in an article, it was a 2-page, and you actually look to get the paper version, and it was near the end.
Right, yeah, it was not done.
Can you repeat?
Yeah,
for the Zoom?
Andrew had his hand up, and then, Mimi.
The elections office for the voters have asked for. They, so, we could have done something split. They, that it should be. I was that's the job.
That's it.
They're asking for trouble. That could be in the voter file.
We're following some directions from a lawyer, so, yeah.
Andrew, they can't hear you. I can.
But Andrew was saying that the elections office is asking for pro and con statements. And that he is suggesting that that is the way for the league to go. We are following our attorney's directions right now, but that's a possibility. And we do not know if it's going to be accepted on the final ballot. For the people on Zoom, Edry was talking about the fact that we did have a statement in the Columbian in January, but it was kind of buried in the article. Mimi,
Can we sue them?
can we sue them? That has never come up. If a cease and desist letter, which is what we wanted national to do. Anyhow.
But I mean, that would bring real attention to the fact that that's not our position, and we want them to stop, and everybody would know it. Whether we go forward with the suit or not, at least it would be out there if we ask our attorney to sue.
Yeah, the question is, whether we can sue on this. I would say at this point, that's not an option that we're looking at. The lawyer's pro bono, so at this point. Anyhow, I don't want to dwell on this because there's going to be some more coming out on it. You have something else to announce at the end? Okay, all right, Irene, are you ready to show us the new legislative districts? Your LBs are changing for this election, and that is going to cause some interesting things.
Well, I don't know if you saw the article in the Voter. Irene Finley from the redistricting task force and Ellie Hutton, we're gonna do this together. Hold it closer? Okay. All right, so for those of you who haven't seen the map that was approved by the court, it's here. Is there any way to enlarge it, John? So that we just get Southwest Washington?
Let me see what I can do.
So what has happened is there's, been changes to about 13 different districts. The bulk of the little ones is about 15,000 population, swirls around. But the hit for the big change was for the Yakima area, Franklin, Benton
I think we
counties.
can move it
They
now.
had a lot of population who changed
Oh,
districts.
sorry.
They're changing the 14th and the 15th, so the new 14th can vote in the
Oops, that's-
upcoming presidential election. There's a weird shape into Clickitat. You can see that there. The reason that weird shape happened is because the tribes, the Yakima tribe wanted to have the traditional fishing villages, traditional lands on the Columbia in the same district with them. So there's been a shift for 17, 18, this, some into 20, yeah. What I came away with after seeing this is we all think that by looking at the shape of the map, we're gonna know if it's gerrymandered or not. What happened here is community of interest through the lawsuit took a precedence. And that reflects the community of interest for the Yakima area as decided by the judge based on the plaintiff's case. I think that's important because One of the things we're trying to do on the redistricting task force is to prioritize the different types of, how do we decide this? We go by, federal requirements, contiguous, maintain political, government entities, blah, blah, blah. Communities of interest has not been officially on the list. Some states have that, where this is the order in which we're going to decide. And without the order, there's a lot of flexibility that it's difficult to control. So, let's see, I wanted you to know that I did look at Dave's redistricting partisan information, because people have been asking. What I want you to know, if you look at the Dave's redistricting maps, that there is a field that can talk about the partisan split and how that may or may not have changed. It is a political issue. We are nonpartisan, but this has all to do with politics. What I want you to know is in Dave's, the statistics for looking at partisan split are fungible, I guess is the word I'll use. Your local parties may actually have better data for party split, but according to Dave's, the 17th and 18th switched a little bit, but they're basically, let's say even. So on Dave's redistricting, you have red shows that it's leans red, blue leans Democratic. Did I say that right? And if there is no particular lean, not a good enough percentage, it's going to be just white. So the 17th and 18th are kind of balanced out. The 20th remains more heavily Republican. So just for those of you who've been wondering that, that's how the Dave's data pops up. What I did today was I brought a map. It's a little handout. So it has a little picture of this map for Southwest Washington, and then a link to the training that's going to be done by the redistricting task force on the 13th. And they're really hoping a lot of people will come and listen to that, because they're bringing in people from the Brennan Center and from California's redistricting process to talk more about what that means. So these are on the desk there. I'll have them there for after meeting, yeah?
You said the 13th, is that in April, today or May?
April.
Oh, so it's today?
Oh, is that today?
Yeah.
What time is it?
You can't go.
Okay, no.
Darn.
Okay, but take the handout, because, yeah, the link is there and you can listen to it. I don't know what day it is. That's what I had to say, and I think Ellie had some things she wanted to add.
Yeah, so something that is important for this is to recognize now that the 49th and the 18th LDs are the only legislative districts that are fully within Clark County now. And so you can see the 20th district has come much further south on the east side of the county. That's where about 15,750 or so residents will now be in the 20th instead of the 17th. And we've collected, when you go outside of Skamania County and you go into Klickitat County, the purple part that's purple there, that is about 15,700. And so when we think about our candidate forums, we have new communities that will we have a lot of people in Clark County who are now in the 20th. It's a bigger region and it's a larger swath. And then additionally, in Klickitat County, there is what's called the unit at large league. So they're not, a specific league like we are. They're members of the state league. But they will be very interested in our candidate forums. And when you think about the distances that the representatives and senator for the 17th LD, they will now be covering basically from just east of the 205 bridge all the way to Goldendale. And so that's from my house in Camas, if I were to drive to Goldendale, it's 2 hours. So it will be pretty interesting, just how it all flows out and who's running for office and what they're gonna represent. Anyway, so stay tuned. And we will want help with the candidate forums. I'm not on the candidate forum committee, but just to encourage everyone, these will be some pretty important forums this year.
And the task force has always encouraged us all to think about asking questions about redistricting.
We can do better, right, Irene? That's the motive for redistricting commission. We can do better. Okay, so I did want to let you guys know that there's a lot going on with candidate events this year. So the League of Women Voters Clark County is doing, we have our candidate committee, which is Melanie Hanshaw is the chair. She couldn't be here with us today. She's in Idaho, but she will be at the member orientation meeting in 2 weeks. And she is fully prepared she wants you guys to start thinking about questions, start thinking about topics for our legislative districts. And it's going to be an interesting race to see who's running and what they're running for and what are the topics that we want to ask them about. In addition to the candidate forums that Melanie's group is going to be doing, we're going to have a separate committee that is for the Washington Congressional District 3 race. And that is chaired by me now, for now. I'm hoping that somebody will help. And we already have volunteers to help out with that. And they're also volunteers that are helping with the League of Women Voters Washington Canada event that is going to be coming up. We've got a date. It's going to be July 18th at Geyser Hall, at Clark College in the Student Center. It's going to be for the Public Lands Commissioner race, of which you guys may be aware, Jamie Herrera Butler is a candidate, and there's others. And that's going to be an evening at 7 p.m. So we're currently, Mary Coltrane has also sent out a save the date email to the candidates that are currently have active campaigns and are registered with the FEC. Okay. The other thing you guys should be aware of is the Washington League of Women Voters Washington Council is you can register for that now. Everyone's invited. It's going to be May 31st to June 2nd. Rick, what do I have to do to make it more exciting? It's going to be, you're busted. South Puget Sound Community College, Lacey campus. The board approved the requests of several of our, we can have 5 delegates. And yesterday, 2 days, no, 2 days ago, we approved Sally Hale, Rick Hale, Susan Fleming, and Ellie Hutton as our delegates. And I've had a request by Dick Halverson to be our delegate. And so the board will be considering that very soon. Everyone can go. They're a lot of fun. And right now, the Susan Fleming's been working to set up a caucus at that council for about Indians. I'm probably not, but Native Americans, and some awareness about what's going on and the issues, and just having a really good conversation. She's brought that conversation to you before, and she wants to continue that conversation with throughout the state, with leagues throughout the state. Okay, so let's see, what else is going on?
Maybe point out that it's in person, but there is an online version, although you won't get as much as you the $25 online reservation for that.
Yeah, most of that information you should all have an invitation to the League of Women Voters Washington Council in your email boxes from Mary Coltrane. Right? I know you all read that email, you clicked, you went and looked at all the FAQs, right? No, you did. Anyway, I can't do it justice. I recommend that you check it out because it's gonna be a lot of fun. Let's see, I think I've got everything. Oh, and so the next steps for the Public Lands Commission is we need to start thinking about what our topics are gonna be, because there'll be quite a bit of back and forth. That event, which is the League of Women Voters Washington, they will decide what the topics are, but we really want to contribute to that effort because we will be there. Okay, details. Thanks, Andrew. All right, I don't have anything else. Does Nancy wanted to talk last? Mary Austin Seymour. Oh, and I think Liz.
I'm just looking for volunteers at the last minute. We have been given the opportunity to do a voter registration event at WSUV on Thursday from 1 to 4. It is in conjunction with a workshop that's being done for students on financial aid. So that brings students into the student center, so we'll have access to them. So see Brenda or me if you're willing to volunteer an hour and a half of your time, either from 1 to 2:30 or from 2:30 to 4, and we will provide parking passes for you.
The other thing that's going on is we are promoting some healthcare town halls. They're gonna be starting pretty soon. Anyone have any information on that? I'm afraid my brain is, but look for that. I think some of those are gonna start this month.
Yeah, I think there was something in the voter about that. Look at your email in regards to council. Council is very, very fun, and the cost is very reasonable this year, extremely reasonable. It's close, it's in Lacey, and if you share a room, it just cuts it way down. Anyhow, I highly recommend council. The nominating committee submitted their slate to the board this week, and we have 2 positions open. Well, actually, we have the nominating committee for next year open. We also have the president and vice president positions open. Please see me or Ellie or Meg McNicholas or Jane Johnson. If you have any suggestions for filling these positions, we are going to call a meeting with members, probably a selection of 2 meetings to attend, to talk about different models of leadership. A president and a board is one model. We are used to that model, but it's not the only model. Shared leadership works with many leagues. Many leagues in the state of Washington have some very creative models of leadership, and that's what we want to talk to you about. So we welcome your input. There are no wrong answers. Don't really appreciate your input on that. Oh, and the sign-up sheet is here if you haven't signed up to help on April 27th.
All right, anybody else have anything? Because a lot of stuff we're going to have a lot of committee reports in 2 weeks at our member orientation. Yeah, go for it.
I'm Deanne Finken. I'm a chair of the State Local News and Democracy Committee. We are going to convention in late June to in an effort to secure national concurrence with the local news and democracy position. Excuse me. And I wanted to thank everyone for the support that you've given, both financial and emotional and all along the way. And the wonderful news this morning that an anonymous donor, and gosh, Sally and I are still trying to figure out who that is, but that person will donated $2,200 to help offset the cost of sending 3 delegates to national convention. And I understand those people, well, Tracy Riley Kelly is planning to go in person. She's a delegate. Sally Carpenter Hale is also in person. Ellie Hutton is on remote and online person. Meanwhile, I wanted to say we've been collecting information about how many delegates have indicated statewide they want to attend. We have, it's kind of wonky how the bylaws, it looks like we have 53 delegate spots. Rarely does a state fill its delegate spots, and right now it looks like we have about 40 people going either remotely or in person, which is really remarkable. So thank you all very, very much, and we're hoping to make history.
Yes. Ellie.
Hi, I just want to add, the board talked about this last week. When people make donations to the league, that is private information and it isn't anything that gets shared with anyone. So I know Deanne is hopeful to know who this person is.
I simply wanted to sit down.
Yeah, okay, but,
My humor was not understood.
okay, no, it's okay. But I just want to let everyone know that anyone who makes a donation to league, it is private information and there's extremely few. The treasurer and maybe 1 or 2 other people know the names of the people. The rest of us just know the dollar amounts. So, anyway, I just wanted to clarify that.
I think that's an important point because it's really important that our donors feel safe, you know, that they can make donations and that we're going to treat them with respect and provide that privacy. Okay, anyone else have anything for the good of the order? No? Okay, I'm gonna go ahead and adjourn this meeting, and so feel free for the next 20 minutes to just chat amongst yourselves. Visit something we don't often get to do.
Thank you for the speaker.
Thank you.
Okay, I'm gonna stop the recording now. Stop recording, right?